that's my cue to start. Hello, everyone. We're going to get started. I want to say thank you for everyone for joining us for the 5th episode of PhysioConnections. It looks like we have a pretty good turnout, which is nice. We have a good diversity of classes as well. This is an event we have been working on since the beginning of the COVID-19 pandemic, and we are very excited to be sharing it with you. The purpose of these Zoom meetings or webinars is to connect the present MPT students who have currently been put on hold from any clinical experiences to physiotherapists across BC who are willing to share their story. This week, we have the amazing opportunity of actually having the incoming class join us as well. So they can get their minds going a few months before the program even begins. So this is the first time we've had them join us, and I see there's a few names I don't recognize, so it must be incoming class. So first off, congratulations on getting accepted, and thank you for being here. Every 2 weeks, we will be hosting 2 guests who will answer 3 questions each related to the experiences they have accumulated throughout their careers. 3 questions are set questions and will recur each week. The first one being, please describe your career path to this point. The second one being, what one thing do you know now that you would like to have known as a new grad or soon to be grad? And 3, how has COVID-19 impacted your practice? Each week, there will be a question of the week, which will change each week. And that question this week is, where do you see yourself going from where you are at now? Do you have a map or technique you use to achieve your goals, or do you just let it unfold? I will introduce our 2 guests for the episode, and then we will go through the questions. The final 15 minutes will be dedicated to an informal Q&A. If you could write your questions into the Slido that was presented beforehand, and Tara will post the link to that into the chat box as well. Just go to slide.o and you'll be able to ask your questions. And you can also vote for your favorite questions so those get asked more frequently. Yeah, without further ado, I'd like to introduce everybody to Carol Kennedy and Mark Rosado. Mark is a great sports physio. Carol is somebody who has lectured the second years, will lecture the first years, and the incoming class eventually, I'm sure, as long as she sticks with it, which I hope she does because she's great. Even online, we got super engaged. So I'm going to pass the mic on to them. They're both going to introduce themselves as they talk about this first question. So I'll go to Carol first with, please describe your career path to this point.
Okay, so I'm Carol Kennedy. I was born and raised in Kingston, Ontario, and I actually stayed there and I did my physio degree right out of grade 13. We had grade 13 back then. And I went into Queen's Physio and graduated with a Bachelor of Science in Physiotherapy. Then I left Kingston. It's kind of small, great place, but kind of small. And I moved to Winnipeg, Manitoba, and I was there for 3 years. So that's where I was as a new grad, and I worked in a hospital setting at St. Boniface Hospital, and I did all my different rotations within the hospital setting, and it was a really interesting way to consolidate my skills at that time. But while I was there, I became quite interested in sport physio, and I worked with a lot of teams. Hockey, football's big there, as well as men's basketball. And I really did enjoy that aspect of being on the field and being sort of first practitioner to assess the patients, the athletes. But then I went a little bit more down the ortho stream. I came to BC and took the first 3-month course. So it was a consolidated long course to do my manual therapy certification. But I went back to Winnipeg because I promised I had a leave of absence. I went back to Winnipeg, and it was great because I could be sort of a big fish in a smaller pond, and I got a lot of experience teaching there, and that's how I sort of moved my way into orthopedic division. So then I moved to Vancouver and started in practice with Deb and Bill Treloar, and I've been there ever since and became a partner of theirs partway through my career with them, and that's where I still practice today. I've been an instructor with Orthopaedic Division as well as an examiner with them for the national exams. I was a chief examiner for way too many years, but I've retired from that, but I'm still an examiner. And I guess that sort of has been my focus in my career. I've done a lot of different committees and executives, as I know Mark has as well. I taught the manual therapy block at UBC it was when it was in 4th year. I did that for 5 years, and then passed that on to May, I guess. And I'm now also involved in that post-professional GCOMPT course, developing it as well as the lead instructor for that. And I guess somewhere along the way, I became known as treating necks. And so I've been attached to the cervical spine for an extremely long time now. And it's kind of nice to have one small area. You only have to read a certain amount, and you can become good at one thing. I sometimes wish I had kept things a little bit broader, but it certainly has brought me all sorts of experiences along the way that I probably wouldn't have had otherwise. So I think I guess that's my path.
Awesome. I like that. Thank you so much. I think it's interesting, your perspective on going from Winnipeg out west and then back to Winnipeg as the big fish who had all the knowledge from these bigger hubs. I think it's really cool and an interesting way to put it, for sure. And kudos to you for actually going back to Winnipeg. That must have been a hard thing to do.
I promised. I took a leave of absence. They guaranteed me a job back. I promised. So I went back for 1 year exactly, and then I hit the road back to BC again. I
wonder if that was the last promise you ever made, just because of going back to Winnipeg.
I was smitten. I had to come back here.
Oh, perfect. Good. Well, we're happy to have you. Thank you so much for sharing that. Let's pass that on to Mark now.
Hi, I'm Mark Rizzardo. I'm born in Quebec, but lived 99.9% of my life in Vancouver. I went to UBC to be a high school teacher. And at that time, I decided in my 3rd year that I didn't want to do that anymore. So I stayed and did a master's degree in growth and development. And at that time, I also applied to be an apprentice coach with the national soccer team, which I got. So I was doing a master's degree and doing an apprenticeship coaching side with UBC. I finished that, and the national team offered me a job with them as their quote-unquote trainer. So I did that for pretty well full time until I applied for physio school at UBC, which by then had split. So at one time, I'm not sure if you guys even know this, but OT and PT were in the same degree. And when I went through, there's no way I personally could do the OT. So once they split it, I was encouraged to do it, which I've done. And then I worked at WCB. They actually had a clinic there. I worked there for about 8 months. And then set up my own practice in Metrotown Physio and have been there since then. During that course of time, I got sucked in actually by Clyde Smith to, just put your name in for, at the time, the Physio Association, physios in private practice broke away from PABC just because we weren't, don't think we felt, there was before I joined them, but they didn't think they were being represented enough in negotiations and stuff. So they set up their own association, and that became the negotiating arm with all the government agencies. So after I was out of school for like 3 years, I think it was, Clyde said, well, come to this meeting and we just need, names in. I'll throw your name in, but nobody knows you, you won't get it. And when it came to, we used to get like 250 owners to these meetings. And, do we have any nominations for president? Clyde says, oh yeah, I've got Mark Rizzardo. Everybody kind of looks around like, who the hell is Mark Rizzardo? And then anybody else? And there's nobody else. Oh, by acclamation, you are now the new president. Anyways, that became my association with being the president of that. And then I headed up a bunch of committees with that. including negotiations. So that lasted until last year. So from 91, 2019, Government Relations Committee, Liaison Committee. At the same time, I decided I was going to go down the sports physio route. So I became I got my diploma in that. I'm an examiner with them. I'm a mentor with Sports Physio Canada, so people that are looking to take the exam. I sit on a couple of committees in Sports Physio Canada, one on concussion. So we have an annual concussion conference across Canada. I'm on the credentials committee that's just wrapped up, and now basically at the end of that, we are now, if you have a diploma in Canada, diploma in sports physio, you are now part of the International Federation of Sports Physiotherapy automatically. Through this whole time, except for about 4 years, I've also been the head coach at Langara College men's soccer team. I've coached Canada as an apprentice coach. I've coached BC at the Canada Games, Western Canada Games. I was the chief therapist for Canada at 2010 Olympics, 2012 Olympics. I've been to 5 or 6 Olympics, 2 I think, Commonwealth Games, a myriad of Pan Ams and Universiade. So that's what I'm doing right now. I'm still working full time. Yeah, and COVID has changed. I'll answer that question later on, but that's my path, and that's what I kind of am. In the clinic, I do see kind of everything, except I'm more of an extremity guy. So I'm kind of primarily see knees. I might see 20 a day, but I'll see shoulders, knees, and ankles primarily. And that's kind of where my forte is.
Great. Awesome. Thank you so much. Both of you could probably write a book and call it your resume, it sounds like. That's awesome. And I know what you mean by Clyde sucking you in to do things. That's how I ended up in this position, but I love it. And I'm sure you must have learned a lot from that experience. So
yeah, I mean, you get to meet all the other physios in BC pretty quick.
Exactly. And
so it is a good way to do it. You get thrown into the water a bit, but yeah, it's been very useful. My undergrad degree, I was in phys ed, but I had a second major in business, and that's come into really important through almost my entire career.
Wow.
And yeah.
I like that. Do you think that is something that's almost critical to have, that kind of business background to run a business? It sounds like a really dumb question, but
it's not a dumb question. I've been pushing for the universities in Canada to do it, a mandated course in it. I've been talking to the school forever. They don't think it's important, I guess. I think it's critically important for the physios that are thinking of going into private practice to take some type of business background. And when you don't do it, you just have to look at the doctors. I mean, they are so ill prepared for private practice. And if you look on the other side, the chiropractors are so prepared in terms of their marketing schemes and everything else. I know physio's getting a little better, I think. I know they bring in some private physios to talk about it, but I can't believe they can't bring somebody in from Sauder and just do some basic courses, make it an elective, make it on the weekend.
Yeah.
Sign up would be huge. I taught at UBC for 5 years, the sports physio course. But anyways, that's my rant for the day.
We had 2 electives out of the whole 4 years we were in physio school, and they were electives, but you could choose out of 5 courses.
Right.
And so I went and asked if I could take 2 business courses instead, and I had to fight like anything to be allowed to do that, but they did allow me to do it, and I think it's been very useful for me. And then I've done a couple of other bookkeeping things and stuff along the way as I was transitioning into private practice, because I think it's really important. I think there's a lot of physios that struggle with the business aspect of their clinic ownership. You learn on the fly, and some people just have a bit more aptitude, and that's why they probably go into that in the first place, is because they have an interest. But certainly we could be better prepared, that's for sure.
Yeah.
Absolutely. Good insight. Thank you both. We'll move on to the second question now. we're going to say, we'll start with Mark for this one. What one thing do you know now that you would have liked to know as a new grad or a soon-to-be new grad?
Yeah, I've thought a lot about that. I mean, it's hard to know, like Coral. I mean, Carol went into, I said Coral because one of my associates is Coral. Carol went into it and she's, super qualified in the orthopedic side. When we do the exam with the sports physio, you have to have a really good orthopedic base or else you're going to struggle. And so there's quite a bit of overlap. And I think that wasn't explained very well to me, I think at the beginning. And I think the other thing is, I just have to realize when you get out of school, if you don't think you're going to learn anymore, like you should just shut it up. Like, because there's things I'm doing right now, like I needle. There's no chance we would have ever done that when I was going through school. I use the laser quite a bit. This is our fifth week back from some COVID, right?
Yeah.
I haven't touched an ultrasound machine. Like I rarely, personally, we use it in our clinic. I rarely use an ultrasound machine. Right. So things changed. Our professions changed quite a bit, and I think it's being recognized more. So I think what I learned is that you need to really be open to new ideas. You need to be open to other people's ideas. And you need to, one of my key instructors when I went through, she was only at UBC for 2 years. She came from U of A. And, one of my favorite sayings from her, and I don't know if she stole it from somebody, she just said, if you listen to the patient, they'll tell you what the problem is. If you listen long enough, they'll tell you how to fix it. And I use that almost every day. And, I think you just have to listen way more than we do. I think that's just us as a profession, but us as in healthcare. And lots of times we don't listen enough.
Right. That's a really good point to make. I think I really appreciate you saying that. I think we've touched on in the past some soft skills, as those need to improve. And Sue Murphy would kill me if she heard me using that word, but just listening is definitely one of the most important soft skills I think we have as physios. So I think it's really, really great that you touched on that. And that's a good answer. Thank you. Let's move on to Carol next for this same question.
Okay, so I agree with everything Mark said. So the first point that I really thought about is I remember when I was a new grad, I tried to go back and put myself in those shoes, which is 41 years ago now. So it's a long, long time since I was a new grad. And I remember thinking that I don't know enough. I don't know anything. What am I going to do as a new grad? And it doesn't matter that you don't know everything now, because you're never going to know everything. And that's what Mark was saying about continuing education, is you'll be consistently learning throughout your whole career. So it's going to start the day you grad, and you're going to be partway through your career and still think, oh my God, I've got so much more to learn. And you'll just take it in, and you just need to be open to those continuing education opportunities. And there's many different routes to do that, but decide what track it is you're going, and find out what your best learning approach is, and go with that. But also realize that a lot of your learning is through your patients and your experience with your patients. So you can't do that fast. Like you've got to have a certain number of patients under your belt before you'll get some of your clinical patterns set, and before you'll be able to recognize certain things. So I think that's really important. So it's not a race. You'll get there. You just be open to learning all the way through. I also think that that you should attach yourself to a great mentor, and I'm sure Mark would agree. He's had mentors, I'm sure, along the way. I've had some amazing mentors that have. And some have taught me certain things, and others have taught me other parts of what's important about being a physio. So I think that is invaluable to sort of work with others that you can learn from. And then get involved. Like, Mark said, being on committees, you get to know all sorts of other physios. You learn a bigger perspective about physio rather than just the little clinic that you're working in. You see the bigger picture and how things fit together and sort of what matters. So I guess as a new grad, get involved and be ready to learn for the rest of your life.
That's a really good point. I think the continuing education, when you talked about that, even just in the time I've been in the program, things have changed already. Like we just recently had some debates on some big topics, and it was part of our this last course that you helped and talked about manipulations for, Carol, where we talked about, is ice important for acute injuries? Are EPA modalities useful? Is P&E useful? Is just a bunch of different things. And it made us all think a lot more than we thought we were going to, because we're like, oh yeah, well, we learned that's useful. But this is also life, is that things are going to change. And then I'm sure 20 years from now, what I'm learning now, maybe it's not useful. Maybe it is. For now it's useful, and for now we know it is, and I think that's the importance of it.
One other thing that I'd like to mention, and I think Mark will probably agree too, is you see the pendulum swing back a lot of times over your career. Right. Isometrics. We used isometrics a ton years ago. Then they went out of vogue. They're not functional. They're just part of the range. You shouldn't, it's not good enough. And then now isometrics and maybe some of the pain management side of that, and they're really sort of popular again. And so never throw away something you learned, because you might pick it up and use it again later, and you'll be so glad that there's evidence to support it. It wasn't that there was evidence to refute it before, there was just no evidence to support it, so it went out of vogue, and then all of a sudden it's back there again. Have you seen that as well, Mark?
Yeah, I mean, I don't remember, Carol, like when we started, and some of the clinics never had an exercise area.
Yeah.
They're just like in and out, and I remember looking at like my background again, like yours is an exercise, and I was like, yeah, that's not the way I want to practice. And all of a sudden now it's a huge part of our practice, right? So I think, I think you're right. There's like laughing about what you learn. Like we learned about shortwave diathermy, and then it's gone by the dodo bird like 35 years ago. Nobody's
microwave too.
Okay. So yeah, I mean the pendulum does swing back and forth, but
yeah, good points. Definitely. There was one thing you did bring up, Carol, that I kind of want to ask a follow-up question on. Is you said, take your time, you'll get there. And what is your definition of there? If our career is all about constantly getting better, has there been moments? Is it moments throughout where you're like, yes, I've made it, but there's more? Or is it, how do you find that there moment?
Yeah. So I guess what I meant by there, because I'm still not there. I probably won't be there when I retire, but you'll get to a point where you'll feel more comfortable with what you can do, and you'll know your limitations, and you'll feel comfortable sending someone on to someone else if you can't solve it, and you'll have enough tools that you'll also know when maybe this patient is not going to respond to physiotherapy, and we've done what we can and we have to refer them on. So you'll get that confidence. That's what will be there, but there'll always be more to learn.
Perfect. Thank you so much. That's a good answer. Okay, let's move on to our third question. So we'll start with Carol for this one. How has COVID-19 impacted your practice?
So it has been quite a ride over the last few months now. So it's impacted me in two different ways, because it's impacted me as a physio within the clinic treating my own patients, but then as an owner, it's also been huge. So, and both of those are a little bit different. And I think that, the physios that work with us, their response to COVID and being shut down is different because their responsibilities are different than an owner, for example. So this is the biggest crisis that we've ever dealt with as a clinic. And we've had a few. We had an explosion years ago when we were out of our clinic for 6 weeks, working out of a sort of virtual, although there was nothing virtual at that time, out of Devin Bill Treloar's living room. And we'd all come there at night and pick up the charts to take to various venues around the city. So we're not new to crisis, but nothing this long and nothing that sort of like such a huge impact that stopped you in your tracks and you couldn't do what you used to do. And we're a large clinic. Our rent's huge. Mark, I'm sure your rent isn't low either. And so there's a lot of fixed costs that you've got to figure out how are you going to weather this storm so you can come out the other end. You know you'll be okay when you come out the other end because you've been established, been around for a long time, but how are you going to get your way through? And then you also worry about your staff. You worry about how they're going to pay their rent. You sort of feel responsible for these people. They're sort of your family. And so I found that, sort of kept me awake at nights as well. Trying to figure out these government subsidies when I have 3 other business partners in our one clinic and another one in our satellite clinic. And each of us would read the same government directive and come up with a different interpretation of what they meant by that. And then as soon as you thought you had it figured out, they would change the rules. And so, it's been a major roller coaster. I think the main thing is we worked on it as a team. I'm so glad that I have partners rather than having to have done this on my own. I have a couple of friends that are sole proprietors and, whatever I can do to help you guys, because I can't imagine what it's like to make these decisions on your own. The telerehab was huge. That's kind of cool. We were already talking about doing some of that, especially for a few things, a few services. Telerehab works really well for. Mm-hmm. Other services that it's not quite so good. And anyone who says telerehab's better than in clinic physio, I don't really know what they're doing with their in physio. You can do a lot on telerehab, and you can do a lot of exercise stuff. You can do all the therapeutic alliance. You can do all sorts of education, things that are really important. But I think even part of your assessment you can't even do unless you have your hands on that person. And certainly, I like to think of myself as a multimodal physiotherapist. I'm definitely exercise oriented, but also manual therapy. And it was hard not being able to get my hands on people. So I think I've said enough. Now it's Mark's turn.
I think that's a good point to bring up. And I think that's been a lot of our question is, without hands-on, like, how do you do that manual therapy? How do you get that full assessment? I just feel like it's so difficult, but good on you guys for trying, and and I like also the clinic owner perspective you brought to the answer as well. How you worried about the clinicians who work for you guys and your partners and everything like that. So that's awesome. Thank you so much. Let's go to Mark for that question.
Yeah, I mean, we're kind of in the same boat as Carol's group. I've got 2 partners. We kind of divvied things up. You very quickly become the CEO. You're not a physio anymore on the business side. You become, we divvied up our responsibilities. So I became more the financial guy. So, the very first morning, March 18th, I was sending emails to my landlord, my bank, my lawyer, my accountant, and on the phone with them, like right away, making deals with our landlord, who's been really supportive through the whole thing. So, you just if you don't have that business background, I don't know, I think some people struggle. I think, there's 2 things that happen in our career. One is that we used to, when I was out, the government used to be covering physio. They would pay, physio is free. So You could go 100 times a year. Government, they didn't pay you very much, but as a physio, but in terms of a patient, it was fantastic. You could go ad nauseum. You could go forever.
Yeah.
Then the government delisted us as insurance, and they said, you know, you're gonna. Well, I was on the negotiating team, and I was telling physios in BC, you got to better start opting out, because if you want to survive. So my clinic was one of the first ones to opt out, and we opted out about 4 years before the government kicked us out.
Okay.
But we were ready. But when they kicked us out, a lot of clinics died. And I think coming out of COVID, I think you're going to see clinics die. Clinics that were not being run very well, clinics that weren't really ready for problems like this. I think they're not going to make it. I think they're going to struggle. And I feel sorry for them, because they would have put a lot of time and effort into it. In our clinic, we didn't lay anybody off. Our physios are independent contractors, but our office staff, we laid one off just because she was part-time, and she was better off being on a CERB. But everybody else we kept on full-time through the entire time. Wow. And the bonus for that, which we had anticipated at the beginning, really has paid off, because before we came back, they were all in the clinic, at home, wherever they were working. And, you know, we're already at 80% billing right now, what we were pre-COVID. Wow. So, you know, we're pretty happy with how things have gone so far. Obviously, things could get better. I think once they get, we're a really high post-surgical clinic. And once they have those elective surgeries back, I think you're going to see numbers go across, you know, rise everywhere across the board. But that's how it's changed us. I mean, we just became, you had to become a business guy. Like, you just couldn't be a physio. On the other hand, you know, I think the college frustrated some people. I'm definitely frustrated me. I'm probably not their favorite person, because I sent quite a few emails to them. I think they were slow on the uptake. And I'll tell that, you know, I've told them that to their face. I've told them in emails. I don't think they supported physios very well at the beginning, for sure. They were very andy-pamby. They weren't making decisions. And I get it. Like, they didn't want to put their neck out and get sued. Yeah. So they said you could only see patients essentially. And as a post-surgical physio, like I said, I made a decision that some of my patients were essential, my post-surgical guys. Like, you know, they're coming out of rotator cuff surgery, out of a sling. Some of my, you know, my ACL surgeries, they were stuck in flexion contracture of about 30 degrees. If we didn't start doing some physio on them, they're going to end up wrecked for life. Yeah. So I made a decision to go in and see them. And I did that for a couple of weeks. I saw about 8 to 9 patients a day, a couple times a week. And then, you know, then I was pretty happy with it, being able to do stuff with them on virtual. And like Carol, like we're going to keep the virtual for some of our practitioners. Like, I think it's really worked well for our Pilates people that can do some of that stuff. Personally, I'm like, Carol, like, I don't know what's wrong with your knee until I get my hands on it. And do you have an ACL? I got to do the test on it. You know, how big the gap in the MCL, whatever. I can't do that over the phone. I can't do it on a video. Right. You can do some certain tests, but you know, it's not the same. And all the docs are the same. When you talk to all the orthopedic surgeons, the sport and med docs that we deal with, they were all the same. They're all like, you know, yeah, we can chat with them, but we can't make an ultimate decision.
Right. Absolutely. I think that's a really good answer. I'm gonna follow up with that. I just want to make sure that all the students who are watching, you're inputting your questions into Slido or voting for your favorite questions, so we know which one is the favorite. Yes, Mark, I really liked your answer. It really goes to show how much you care about your patients, and I think it's such a hard thing with physio too, because as physios, to me, it would be so hard to have any patient and just be, you're not essential. Where I'm like, well, no, I'm doing this career because physio is essential. Like, we need physio. So like, where do we draw that new line with COVID? I think is a
hard thing. I mean, I felt bad for the college, because they were put in a hard spot. Yeah. But I just think that personally, if you're a leader, you got to start making hard decisions. Carol would have made the hard decision in their clinic with regards to how they came back and how they functioned during it. We did. Right. But, you know, at the end of the day, I mean, a lot of us were on conference calls on a weekly basis. And, Rick Lau is, say what you want about Rick Lau. I would say some of those conference calls were good. I stayed on them they were on for once a week. One call, I think he had like 1,800 owners across Canada on one call.
Wow.
And, it really showed that it doesn't matter if you lived in Vancouver and Vanderhoof and Nova Scotia, Newfoundland, everybody was going through the same thing.
Right.
And it was good. It was I think it really united physios across the country, actually.
Yeah. I think it's in a weird way done that with just people in general too. Like not even physios. It's just it has this weird uniting front about it. And I find myself so much more understanding when I go out now and stuff like that. And I imagine you've probably gotten the same kind of from your clients now. They're like, oh wow, thank you. Like they're probably very grateful to have you. They realize what it's like to not have you. They have you back. They must be quite happy. And so yeah, thank you both for doing what you're doing despite COVID and everything, and gowning up and breathing in that CO2 and getting nice and warm. We're going to move on to the last question now. So for this one, I think we start with Mark. Where do you see yourself going from where you are at now? Do you have a map or technique you use to achieve your goals, or do you just let it unfold?
You know what? I kind of been lucky. I've just let it kind of unfold. I've been lucky. Like I've consulted. One thing I will say is that when an opportunity arises and you have the ability to do it, do it. And I consulted for a video game company, EA Sports. You may have heard of it before. Yeah. So I did that for about 14 years. I've traveled a lot with them. I met a lot of high profile athletes through them. I consulted with the Minnesota Wild in the NHL. I've gone over to Man United and given a talk to their medical and sports science team and their coaching teams. So, you get the opportunity because you are involved in other things, and then you got to go, I don't know if I can take 4 days off or a week to go do it. And I really encourage people to just do it. We had a physio that is in pediatrics, and she had an opportunity to do a 3-month locum up north last fall. And she was kind of nervous to ask us if she could take a LOA for 4 months.
Yeah.
And I'm like, yeah, Kat, just do it. Like, and she loved it.
Yeah.
And I think going forward, I can see myself doing a lot more consulting with various teams, both in town and out of town, and some of the bigger organizations in Canada in terms of multi-sport. My bent is obviously towards sport. And so, that's where I think I'm going to end up doing some stuff like that.
Perfect. I like it. All right, let's move to Carol for that question now.
So where do I go from here? I've actually been really happy with what I've done within my career and the opportunities I've had. And like Mark, things just sort of come knocking to your door sometimes. And you sort of, with me, it wasn't always how much time can I take off, because I was always happy to take time off. But it was more, how can I put one more thing on my plate?
Yeah.
How can I fit this into the week? But how can I say no? Because what if they never come back and ask me again and I've lost this opportunity? So I sort of had a plan, and I knew I wanted to be instructor. I knew I wanted to be examiner. So that way, yes, I've had a path on my way through. But boy, it's sure gone a bit of a twisty route along the way, when different things have been offered to me. And so then you head off in that direction, and then you head off in the other direction. And so I plan to sort of still listen to what's available and take whatever opportunities I have. I've been really involved with Orthopaedic Division the whole way through, and they're doing a big revamp. So I guess I'd like to help see that through and see that sort of changed with evidence and with where physio's heading now. So I'd like to still be involved with that. And then I really want to make sure that the graduate, the GCOMPT, the Graduate Certificate of Orthopaedic Musculoskeletal Physical Therapy, do you think? You see why we call it GCOMPT instead.
Yeah.
I want to see that on really solid footing. We've got a really good number of applicants this year, and so hopefully it's here to stay. And so that's sort of the big thing that I'm going to work on before I retire. And then I think my focus as I wind down, as Mark says, he's going to do more consulting, is I think I'll do more mentoring, which is sort of consulting, but it's more with individual physio rather than larger groups or teams or that sort of thing. I've always loved doing that. I like teaching in a course situation, but I really like teaching when there's a patient right there with you and mentoring. And that's why I've just loved that with the physios in my clinic. So I'd like to do more of that. I can see myself as I retire stopping maybe seeing patients, but doing mentoring instead before I say that I'm really done.
Oh, great. That's awesome. I think us students love hearing when people say they want to be mentors, because I think it can be a scary thing at first to try to find a mentor, have somebody who's on the same wavelength, and it just seems intimidating to ask somebody to be a mentor. So it's nice to hear that there's lots of people out there who want to be that way. And I think these episodes or this PhysioConnections has really shown that most physios out there really want to help the next generation of physios get to that level, because they just want to see the profession kind of skyrocket, if you will.
I guess we also feel like we have to give back because others did it for us, so it's our turn.
Yes. Yeah, there's that too.
Pass it along the line.
Yeah, perfect. Well, thank you so much. So let's go to the questions. So now I'll ask some from Slido. So this first question, I'll let whoever kind of has an answer, they can go ahead and buzz in, I guess. Do you have any suggestions or resources in regards to gaining knowledge for the business side of private practice? So we don't get it in schooling and we won't get it. Is there anything you can suggest that we do after graduation or even before graduation that will help us out?
I think just take a basic business program. Like a lot of the schools have it. Langara probably has it. BCC probably has it. You can do one out of BCIT. You can do it at night, and especially right now, everything's online, so it's even better. Mm-hmm. But you need to take just a basic, what does a reconciliation, what does that bank account reconciliation form what does that look like? What goes into it? Right. Like I can tell you, and I'm sure Carol did the same thing. Like when I started my practice, I did everything. I was booking patients. I was doing the reconciliation. I was doing the banking. I was doing everything. My partners now, they've never done that. They just came in after the practice is already established. If I told them they might be a bit better now with COVID, but to go in, they wouldn't be able to do it. They wouldn't do it. Like we have an office manager. I'm sure Carol has as well. And, we train them how to do certain things that we want. But you really, really should take a basic business course. And it's unfortunate the university doesn't see it, but I would just look after yourself, like educate yourself, take a course somewhere. You can do it online now. They're really moving to that way. And then you can kind of sort it into your life.
Perfect.
Like business 101, and just get some basics. And I also think so I have my business as part of Treloar Physio Partnership, but I also have my business, Carroll Kennedy Physio Corp. And there's a lot of teaching and so there's other stuff in there. So even though I have an office manager and bookkeeper and things for Treloar Physio, and that takes care of that stuff, I still have to do this other stuff, and I still do it myself. So also do a little course on QuickBooks or Quicken, whichever form you want to use, and understand how to do that and what it means and what your different expenses are. And yeah. Otherwise you really will not have a handle on what's going on from the business aspect.
And, I will add, just like anybody else, you get a clinic and you kind of get your team around you. I think as a physio, and my daughter's a physio now, and I just say, get your team around you. Like, get your accountant, make sure you have a lawyer, and that's your team. And going forward, make sure that your accountant's not 100 years old, so you can kind of grow with them.
Yeah.
And then you can bounce off ideas, with your team, whoever it is. And I think you kind of need to have that. It's really worth having a really good accountant, I can tell you that.
The team of professionals is good, but your partnership team is also important. If you have different personalities within that partnership, that people have different fortes, and maybe someone has more of a business background like Mark does, maybe somebody else has more a psych background and can help with some of the HR problems and things. So you assemble that team within your partnership as well, and look to see who would augment it.
Yeah. Absolutely. Perfect. Great. I'm wondering, it's not a question on there, but I was wondering if, Mark, you could touch on a little bit of your experience as the chief physiotherapist in the Olympics. I think some people might be pretty intrigued and want to know what that entails. Yeah. Yours. It's yours.
It's fun, but it's a lot of work. I did it while I was still working full time. Anytime you go to any major games now, you're looking at a month off work, and it's not paid.
Okay.
And so, you got to budget that for your year. So going as part of the Olympics, like, I got asked to apply for the 2007 Pan Am Games as the chief. And you go through just like any other job, you have to go through an interview and things like that. And then that shortlisted me for 2010. And then once you get it, you're a lead of, like, I was the lead of all therapies. The only one you're not covering is the docs. So you're in charge of massage, chiro, physio, anything else they bring in. So I had, like in Vancouver, I had, I think it was 45 therapists underneath me. And that includes therapists that come as part of your core team, but also therapists that might be designated with their sport. So you might be like 2010 is the winter. We had NHL hockey. We had NHL players, and they brought their own therapists with them, right?
Right.
So even though they're responsible to the team, overall they're responsible to me. And so, I'm not going to tell them, like rudely, you can't do that. But yeah, there's certain things that we could tell them, these are the guidelines in our group, and you kind of have to adhere to it. So, so we have a big group, and you're in charge of everything. Like, you're in charge of when they arrive, what their schedule is, what teams they cover. If they're not covering a specific team, you're working with all the docs. So there'll be a chief doc, and then there'll be somebody overseeing the entire thing. In Vancouver, we worked with VANOC, which is the organizing committee. Right. So you're dealing with them. So if the games weren't in my town, like we were here, like in London, we're in London. So you're going to London, I don't know, I think between 2 and 4 times at least with your group. Sometimes you just bring your core medical team to give them a site. And then you're working with all the leads of all the stuff like the Canadian Olympic Association has. So they'll have a lead for transportation. They'll have a lead for accommodation. They'll have a lead for, and so there's, I think in one board meeting in London, all the leads were on one trip. And I think there was 29 of us. Wow. And so you kind of have to learn, what everybody else is doing just so that you can be part of the equation, right? So yeah, it's a lot. And you're responsible for things, like, how Carol was just saying about COVID, like nobody expected it. But at the Olympics, like in 2010, one of the major things is that one of our figure skaters' mom died. Right. And so you're dealing with that. Well, not luckily, but earlier in my career, I've had to deal with 2 of my athletes' parents dying while we're on a trip, and telling them at separate times that their parents died. So you kind of, but at the Olympics, it's a little different because now you've got media. You do some training in media, and you learn how to deal with the media.
Right.
You got to deal with that. You got to deal with your coaches. You got to deal with the Canadian Olympic Association. There's a whole bunch of people, and you don't want to piss too many people off. But you got to make some decisions. And so it's, I know, you just got to be a bit of a leader, and you kind of make decisions. I just find it easier sometimes to make decisions on my own and then ask for forgiveness or bounce off. And one of the side effects of that is I've become very, very good friends with one of the docs, is Bob McCormick, and he's going like 100 miles an hour. He has just stepped down as the medical director of the Canadian Olympic Association.
Wow.
And but you just learn, like, we're having conference calls. Everybody's based back east, right? And Carol, grew up in Ontario, and they think that's easy. Why don't you just have an 8 o'clock conference call? Well, yeah, that means that's 5 o'clock here.
Right.
That's what we got to do. So, because I see patients at 6 o'clock in the morning.
Right.
So, okay, let's do a 5 o'clock call. So I'm in the clinic at 5 o'clock on a conference call. So, people don't see that, but, oh, it must be so great to be part of the Olympic, yeah, it is, but you're putting in a lot of time in, but like I said before, I love it. And so, lots of people said to me, why would you do that? Like, why would you take a month off? And I'm like, because I love doing it.
Yeah.
And so, you can't put monetary value on certain things at the time. It's not a bucket list thing, but yeah, the Olympics aren't going to come back to Vancouver too fast. Maybe 2030 now, but
yeah.
But it's a lot of work, and you kind of have to have thick skin, because you're not going to please everybody. And at the 2012 Olympics, I didn't take a chiropractor with me. The entire medical team. I took a lot of flack for that from the Chiropractor Association, right?
Right.
But I did my homework. I went to everybody, all the associations, all the sports, and unless they were taking them with as part of their team, like swimming always has one, athletics always has one, we didn't bring an extra one as part of our core team. That was my decision. You kind of just make that decision.
Awesome. Thank you so much for that insight. I think we're so, wow, Olympics, that's so cool. But yeah, there's definitely so much work that goes into getting to that level of being a physio, and then obviously the 1 month. And I didn't realize it was a 1 month of unpaid position and stuff like that. So thank you for doing that. That's awesome. So next one, we'll just go to Carol. What is your opinion on taking additional courses right after graduation?
Absolutely.
Yeah.
Absolutely. No need to delay. You've learned some core skills at school, but you need to build on them. And waiting around for a year or two is tough. You guys have a disadvantage compared to what we had, or at least I went straight from high school into physio. I was a physio at 21 years old, right? So I had lots of time before I wanted to do other things, family, stuff like that. I would just say, just get started. Once you get started, you don't have to get through everything in 2 minutes, but just start learning more. I have always been a strong believer that the bigger your toolbox is, the more you have in there, the more likely you are to be able to help people, because no one patient no whole group of patients are going to respond the same to one treatment approach. And you're only going to get that by being exposed to it through continuing education. So you have to choose wisely, because you only have so much money. You're in debt, and you're trying to learn more at the same time. So choose what things really attract you to start off with, and then have a bit of a plan and a budget, and get going right away.
Perfect. Good answer. Thank you. Mark, I'm sure you echo those comments. Do you have anything else you'd like to add?
No, I totally agree with Carol, and I think, I'm going back to my talk to the sports science group at Man United. I was shocked, like they were so close-minded. Like when I said that, we did case studies just to kind of, you don't want to go in telling them what to do. So, and just to tell them that, well, yeah, I would manipulate that joint, or I would needle that muscle. They were just freaking out, and they, to this day, will not do it. The guys at Man United don't do it. to the point where now their doc took the needling course and he does it.
Oh, wow.
Physios, do the physios to this day do not do it at Man United. And they just so close-minded. It's unbelievable. I think, what Carol said is right. Like, take the course and you can always upgrade it later down the road. But, the toolbox, if everything's a nail, everything, you're just going to use a hammer on it.
Right.
And you just got to, there's lots of tools out there. You just got to learn different ones than the ones you're comfortable doing, so.
And you may take a course with a certain type of skill and you end up deciding that it's not really for you, and maybe you don't find it effective. Maybe you find something else works better. That's okay too. But you're not going to know until you learn about it, try it, and see what the response is, depending on your patient population.
Right, absolutely. I'm not sure if either of you know who Eric Marriott is.
Yeah.
He gave us a really good talk one day on continuing education courses, and he showed us the mass list, and he's taken so many. And then the next slide he highlighted in green which ones he uses now. And then the next slide, this is what another physio who takes the exact same courses might end up doing. And it's all finding your own PT identity, I think, which is what we all want to do, and we all want to figure that out. So, and maybe that's there is when you find your identity a little bit more.
Eric's he's a bit over the top. He's a bit addicted to continuing education, that boy.
Yeah. He's
a great physio at a very early stage. So
yeah, he's quite committed. But with that, we are out of time now. I want to say thank you both to Carol and to Mark so much for your contributions. This has been a great discussion, and I like to think I've learned a lot from this. I'm sure every one of the students listening, whether they've taken many physio courses or they haven't even touched one yet because they're waiting to start the program, has also learned a bunch. So thank you both so much. That was fantastic. And you are going to see some people say thank you in the chat if you take a look there, which is awesome. So I'll get Carol and Mark, if you could stay behind, just to get a little bit of feedback from you.